Hey, welcome back everyone. This video I'm going to be doing on the medical system. So it's not something that I especially enjoy to talk about, but it's extremely important. I'm also part of the medical industry, but it's important that people know how the medical industry is run and how it came about and how it has changed and what it is today. So in different countries, medical systems work in different ways. It's either um, a universal medical system, or there's a private medical system, or it's a governmental medical system, or it's a combination of these. So when it's private medical, everything you do yourself. You get a medical aid, for example, or you just go to the doctor and you pay everything yourself. So generally, a private medical care system in a country leads to extremely high prices. When it's a governmental or a universal medical coverage, the prices and the cost is usually lower, but it can take longer to get to see a doctor or get treatment, and then there can be added costs or costs that you bear yourself above the coverage amount. So it becomes quite complicated, but if you look at 100, 200 years ago, there wasn't really this medical system that we have now. People kind of took care of themselves. There were doctors and practitioners, that people that would be able to help you if you had a problem. But generally, you'd go to nature. You'd get medicinal plants, medicinal herbs, and you'll try to treat yourself and help yourself. Doctors were there for the extreme cases, so emergencies or accidents mostly. So if we look at it now, it's completely changed. They are there for everything. If you have a slight cough or something has happened to you, a cut on your finger, sometimes people run to the doctor for every single thing. There's research that shows that the more doctors there are in a country, the worse people's health is. There's also research that shows that the more people frequent doctors, the more they visit doctors, the sicker they can become, and the worse their diseases become. So if you look at, for example, in America, there was a doctor's strike, a medical care strike. So if you look at before, disease was quite high. If you look at during this strike period, everything decreased. So there was less sickness, there was less disease. So if you look similar to our situation at the moment, where everything is coronavirus, flu, the cold, it's basically non-existent anymore. So it's only coronavirus. There's no flu, no cold. So make of that what you will as well. So if you look at what is behind the medical care system, so I'm not against doctors, I'm not against medical practitioners, but they are backed by pharmaceutical companies. The pharmaceutical companies have become giants in world industry. They have bigger profits and bigger turnovers than some countries. So when this happens, it causes problems because they have too much power. So the pharmaceutical companies, in essence, control doctors. They control what they prescribe. They control the research behind those medications that they develop, that they want people to prescribe. Because in research, there are certain formulas that you can use to get the results that you want. If you want this medication to decrease the risk for heart disease, then you choose a certain group of people, you make a calculation, see how many people you need to get a positive result, and then you'll use that. You'll purposefully not use it in a population that will alter the results or skew the results that don't meet your needs. So the pharmaceutical companies can manipulate the data in such a way that everything goes towards what they want, the result that they want. So if they start with 10,000 people and in 2,000 people they don't get the desired result. They throw out those 2,000 people, they keep the 8,000, and they have a positive result. That's just an example. And then they'll also, instead of comparing medication to nothing, they might compare medication to another medication, or they'll compare a medication to an unproven other medication, or they'll use something that is not as tangibly monitored. If, for example, something like a plant-based diet, which is not as easy to implement in people without having outside influences, or they'll study it in a certain population. For example, they'll have used the medication in a population of smokers, which then change the data or the results. And they'll use it in different age groups, different populations, so that they get results that they want. So this can be extremely beneficial because there's lots of data, lots of research. They support a lot of places, they give money, they give research grants. So this is beneficial, but then the research is all, you need to get a positive result, positive data that support their products. So you don't get the data that is negative, that is excluded, because then you won't get a grant again, or the pharmaceutical company will stop supporting you if you find, or if you publish research that goes against them. You can do a bit of research on this yourself. There are many, for example, TED Talks on this. There are research materials. There are many people who talk about how the pharmaceutical company bends and twists the research. It's also called bent research because it's not real, proper research. It's not done in a proper way. It's manipulated so that you can just get the results that they want. Then also the publishing houses of the research publishers, they do not pay the researchers. The people doing the research don't get any benefit from publishing, actually. The publishing houses take that research, they publish it, they sell it, so it becomes hard to access research without having to pay a lot of money. And it's usually between $30 and $60 to see that research article once. There are ways around it as well, but that's beyond the scope of this video. So it's extremely hard to get hold of good research. Good research is sometimes excluded from being published because these publishing places also use something called peer review. So if you want to publish something that other people might not agree with, you've done the research, it's proper good research, but the other people don't agree with your results, then you won't be published. If this person or that person doesn't like you, you will not be published. If you have a reputation of being a rebel or producing research on certain topics that are sensitive or that is not supported by the big companies, then your research will not get peer reviewed, it will not get published, because these scientific journals are supported and sponsored by the pharmaceutical companies, by the dairy industries, by the meat companies, by all the individual institutes in the countries. So they are supported by the things that are causing disease in the first place. So if you also think about it, what happens if there's no disease? The whole medical industry falls flat. There's no more market for the medical industry, especially the pharmaceutical companies. If people start using medicinal plants and they start using herbs and they treat their own diseases, where will the pharmaceutical companies go? Where will they get money? So that's why they're always against the natural things, the herbs, the natural medications and medicines, the plants and the roots and the bulbs and the teas. That's why there's not as much research into these natural remedies, is because the pharmaceutical companies have nothing to gain from it. They take the active ingredients from plants, add some other things, and then they produce a medication from it. But it has a list of side effects as long as your body. It has you can get almost any kind of thing symptom from taking a pill. Do yourself a favor and go and read through that and see how good you feel after taking that pill, where you can have a plant or a herb or a tea that does exactly the same thing with no side effects. I talk a lot on this channel about herbal remedies and plants and things, and there are many plants that are beneficial to your body, and many of them have been made into medication. If you take, I talked about pain medication, so the white willow bark, the salicylic acid, that's been taken and made into aspirin. So some of the natural substances have also been made into medications so that the pharmaceutical companies can benefit. Then you can also look at the big lawsuits that the medical industry has faced. So how much they have harmed people in America recently. Some of the pharmaceutical companies have had to pay billions of dollars because of misinformation, because of advertising on television. And then people are dying, people are getting sick because of this medication, and they don't disclose it. So the pharmaceutical industry is there to keep you sick. They want you to go to the doctor so that the doctor can give you medication that will take away your symptom but not take away the cause, so you stay sick. So you get sick, you don't know what the origin is. You go to the doctor, your symptom is treated, the origin is still there. So you go home, the origin is still there, nothing has changed, so you'll get sick again, so you go back. So you stay in this circle, you stay in this medicated state that you always have to go to the doctor to get the medicine, because then you feel a little better, but the underlying cause is still there. That's why you need to try and find someone who will treat the cause and not just the symptom. If you have the flu and you go to the doctor, they give you something for your runny nose, they give something for your headache, they give something for your throat. They don't give you something for the original cause that is giving you flu. The static lymphatic system that is not moving, that's causing your mucus, your lymphatic system to putrefy, and that is making you sick. So you need to treat the cause and not the symptom. So that's what the medical system has become. It's treating symptoms instead of the cause. They are especially good with emergencies. If you have a broken arm, if you've been in a car accident, by all means go to the doctor. They can help you in emergency situations. But in other situations, it might not be as beneficial for you to go to a doctor. There might be better ways, better remedies that can heal you, that can actually treat the cause instead of the symptom.